One way that we further verify whether or not your fallopian tubes are open, because that could be a seat for infertility, is by doing what we call a hysterosalpingogram or an HSG. And this can be not only just diagnostic, it can be therapeutic. There's lots of times you can have mucus plugging of this area. So if you're a generalist, just doing a hysterosalpingogram can be helpful by flushing the tubes, and there seems to be about a 6-month increase in fertility after doing a hysterosalpingogram. The disadvantage of this whole thing is though that you're exposed to radiation in doing this. So we try to minimize the amount of time that you're on fluoroscopy, but it can be very therapeutic as well as similarly very diagnostic, especially if you have a history of a uterine anomaly. So this is the outline of a normal hysterosalpingogram here. This is the walls of the uterus separated again, now being expanded by radio opaque contrast dye, and the dye going out through the fallopian tubes here on the right and on the left. This is a abnormal hysterosalpingogram. This is actually when a woman is closed, has her fallopian tubes closed because of a previous, let's say, chlamydia infection. And notice here the dye doesn't diffuse out of the tube. There's this cutoff here, and then the tube is almost like a water balloon. It will expand and get larger in diameter. It'll look like this sacculation. If this was your fallopian tube, this is what it would look like. And then I have a picture here of the fallopian tube at laparoscopy. This is the closed early filling of a hydrosalpinges. You can see here that the ends of the tube don't have the nice fimbria here. They're all agglutinated together. And then when we put indigo carmine dye into the uterus, so we can kind of show this contrast, you can see how large this tube expanded to. This tube's diameter is about 5 to 6 centimeters in diameter because it's the same size as the uterus here. So this is a badly damaged tube that we removed. I'll go ahead and talk a little bit about this later, but when we have people with a hydrosalpinges and we diagnose that, we often go ahead and suggest that they have that tube removed because fluid that can accumulate within the distal end of that fallopian tube during the normal menstrual cycle can transudate back and coat the walls of the uterus. And so this was some of the thoughts of why women with hydrosalpinges had lower fertility rates when we put embryos back in, because the embryos were not be able to adhere to the endometrial surface. So now we electively go ahead and take out hydrosalpinges even if we're going to do something like in vitro fertilization and then do an embryo transfer. And then the next aspect of this is, if you want to avoid the radiation from a radiograph in a hysterosalpingogram, but you want to know whether the fallopian tubes are open, then you may not be able to actually do that without putting some type of fluid or contrast through the fallopian tubes. We've developed this procedure called a HyCoSy procedure, or hysterosalpingo contrast sonography. This is where we'll mix air and water together and have those diffuse through the fallopian tubes at the time of ultrasound. And so this is a HyCoSy procedure where we'll expand the uterine cavity again. This is what we see on 3D ultrasound. And then we'll shake the catheter and the syringe that has the fluid and air mixture, and we'll shake it to form bubbles. And then we'll watch the bubbles infuse as we infuse that fluid into the uterine cavity, go out through the fallopian tube, and go across the fallopian tubes. We do the similar situation at laparoscopy when we put indigo carmine dye, which is a blue dye, through the fallopian tubes, and we can visually see this. So the HyCoSy is kind of a forerunner for something that we might do at laparoscopy, but we can get a good idea by watching air and fluid going out through the fallopian tubes to see whether or not those tubes are open.